Mama ke hitele yatina ntefuta tajali asobe mato ninte buto Mama ke hitele yatina nteye ninjali asilota kang futani na roma hitele yatina ntefuta tajali asobe mato ninte buto Mama ke hitele yatina nteye ninjali asilota kang futani na roma
Good morning to you all. It is a great pride and honor to welcome you all to this special occasion, the commemoration of the World Malaria Day. A day set aside as a solemn moment of our collective journey to improve public health and well-being. Today we have gathered here in Brufut village to join the rest of the world to commemorate this special day with the theme, Malaria Ends With Us, Reinvest, Reimagine, Reunite. Your presence in this auspicious occasion has manifested our readiness to continue our collective efforts to complete the journey with the high commitment at different levels of our society to a malaria-free world. We have accelerated the fight against malaria for a more equitable world as the theme for last year's commemoration implied. And today we are tasked to end malaria with us with investment, imagination, and resignation. Ladies and gentlemen, with these few introductory remarks, I want to take this opportunity to call on the Alcalo of Brufut to welcome the gathering.
Alhamdulillah Rabbil Alamin. C'est ala tentu ni yenda tena nyaton ko ila tentu ni en ala tandina okola be tarra te kenya kilu nyama kanyo tentu kanyo jaye kabonna santo to katandu oto kan nse butu be tentu nse jaye ila puto jang kama ben peja kay duwe ka fay ko ala barka baay butu tento ko la ka duwe nse na banko nyaton ko tentu president Adam Barrow nse ala mansa kunda molu milisa minu nyaton kaya jang ka babirate milisa fawto fo amo labonto nte kilin fo no bari isa ko ni kenya nyama asede ko jetentro murundi ani jairo murundi ka welcome murundi nalale kan minni kata bantala molti kan ni wolbelbe ma beri jang ka tandin ko be mbale to jang mantara Gambia la bangoto mantara Brufut bangoto mantara tundo bangoto barbe dunia la bangoto nka kuma kama moy nyami dunia be wala bindi ngam bulo dum wol nim wala ba ke kan nyola o tan si tarlo rin ko be dunia le be ngam o to be mbal mi yinti a be warta Gambia bara be warta Brufut fana yele nin ka fa be lorin nyaatil wala nka dunia be ko Brufut la kono o to nga ala tantu butun ko le ala tantu o to lum tawlum min nata mbe welcome la ñe jiya ka ko albisimila ko tanaw tanatiye fo kontano anin kontano anin ka duwe ko inata wali nyami nin sondeme sanawala alse sayni yalto ni wo sondeme sanawala woto insa fo molbe ko ya baraka baka wato mi ya di ni ngaji be kayto bala anin mbe satarola wato minna jampata nyolal wato falinta baka woto maaje ko diamo bi min nyanta jampala baraka fo molbe ala baraka baka alla najam. You are welcome, you are welcome, you are welcome. Thank you very much, Mr. Minister.
Thank you, Baraka Bake Al-Kaliba.
Dr. Ahmed Lamed Samate, representing His Excellency, the President of the Republic of the Gambia, Mr. Adama Barrow, in this occasion. WHO country representative, UNICEF representative, representative of the governor, and all protocols duly observed. World Malaria Day offers us an opportunity to highlight the achievements and breakthroughs that have been made in the fight against malaria. It also gives us an opportunity to raise awareness in the fight against malaria for those who are most affected by the disease, such as children under 5 years and pregnant women. It also highlights the need for our responsibility, be it at individual, household, community, and the nation as a whole. The Gambia, under the leadership of the Honorable Minister of Health, Dr. Ahmed Lamin Samate, has achieved significant gains in reducing malaria burden over the last decade. The number of confirmed malaria cases has dropped by more than 50% in 2024, from 249,437 in 2015 to 107,926 in 2024. The current malaria strategy plan is grounded on a firm footing for eliminating malaria in the Gambia. But there is no room for complacency. Despite the recent achievements, we still have to accelerate our efforts with a view to achieving malaria elimination in the Gambia by 2030. This year's theme, Malaria Ends With Us, Reinvest, Reimagine, Reignite, is a very fitting theme in the Gambia per se, meaning we have to re-energize and accelerate our efforts towards the goal of achieving malaria elimination in the Gambia. Allow me, Your Excellencies present here, to finally thank all the partners who have supported the 2025 World Malaria Commemoration and this grand rally being held here at Brufut. On that note, I want to thank all of you for your audience. Thank you.
And Ebeling, representing the Honorable Governor of the region. I just want to remind the gathering that in today's commemoration, we have two components. One is the commemoration of the World Malaria Day, and the second component is the launching of the Accelerated Malaria Elimination Project funded by CITCA, China International Development Corporation Agency, through the People's Republic of China, and the IFRC, the International Federation of Red Cross and Red Crescent Societies. With that, I now have the honor to invite Mr. Alexandre Clauden de Vanessy of the International Federation of the Red Cross and Red Crescent Societies for his statement.
Chairman, Honorable Minister of Health, representing His Excellency President Adama Barrow of the Republic of the Gambia, Ambassador, Republic of China, WHO country representative, representatives of CRCS, Chief of Sanimentering, Alcalo of Brufut, Regional Director of Health, Western 1, Scout Band, Media, all existing protocols respectfully observed. My name is Aide Jengjai. I am the Regional Director for Tourism, West Coast, representing the Governor, who is sadly unable to be with all of us here today. As we all collectively observe World Malaria Day on this day with the theme, Malaria Ends with Reinvest, Reimagine, and Reignite. Let us take a moment of reflection on the gains made by the government of the Gambia with support from partners on malaria prevention, elimination, intervention. Through effective partnership and collaboration, the Gambia government is committed to transition from malaria control to malaria elimination. The Gambia has developed a collaborative working relationship with neighboring Senegal. The two countries have a memorandum of understanding that governs their communication, data sharing, program interactions. To date, the two countries have successfully implemented synchronized insecticide-treated net distribution campaigns along the borders, as well as a cross-border malaria-based surveillance response exercise. Another such mass insecticide-treated net distribution will be simultaneously conducted by the two sister countries to enhance malaria prevention and control and intervention. There is a renowned commitment of government and partners to provide funding, support for cross-border data sharing between the Gambia and Senegal, strengthen national entomological and monitoring, develop and update national social and behavioral change strategy, pilot community-based intermittent preventive treatment during pregnancy, including ITN distribution and use especially in areas with high transmission of malaria. In conclusion, I implore all stakeholders and partners in development to put our efforts and resources together in drive to malaria elimination for a more productive and malaria-free population to attain our set target goals within the National Development Plan. Distinguished ladies and gentlemen, I want to take this opportunity to assure that the government of the Republic of Gambia, under the leadership of His Excellency President Adama Barrow will continue to support effective and efficient health service delivery in the drive towards health coverage and thereby attain the Sustainable Development Goals for health through effective collaboration and partnership. That was the message from the governor. I just want to add one sentence because it is felt, coming from a tourism background, it is felt that malaria elimination is everybody's concern. I will take an example from my sector. If malaria is eliminated, the number of tourism arrivals will increase. Because with malaria, we will not have many tourism. And when the numbers of tourism increase, everybody knows the benefits of that. The country will benefit, the GDP will increase, etc., etc. On that note, I thank you all for your attention. Assalamu alaikum.
See, Honorable Minister of Health, Excellency, ambassadors of the People's Republic of China and the Gambia, distinguished guests, friends from WHO, different agencies with us today, authorities of the Gambia Red Cross, partners, health workers and friends, and all protocols duly observed. It's both an honor and a privilege for the International Federation Red Cross and Red Crescent Societies to join you today as we mark World Malaria Day. We know that the malaria community, like others in the humanitarian sector, is facing challenges. This year's theme, Malaria Ends with Reinvest, Reimagine, Reignite, reminds us of our collective responsibility to re-energize effort at all levels, from the global policies, advocacy and resources, to national leadership, as we are doing today. Ladies and gentlemen, as we heard recently from our friends and colleagues and authorities, malaria is more than a health issue. It's a barrier to development, a burden on families, and a threat to vulnerable communities. But at the same time, it is also a disease we know how to prevent, treat, and with collective effort, we can eliminate. So today we are marking and embarking on World Malaria Day. We are also proud to launch the Accelerating Malaria Elimination in the Gambia project, a critical initiative made possible through the generous support of the China International Development Cooperation Agency, CIDCA, and driven by the unwavering commitment of the Gambia Red Cross Society to ensure community health strengthening in partnership with the IFRC. The support provided through CIDCA allows the IFRC and the Gambia Red Cross to concretely demonstrate through augmenting existing funding and filling critical gaps. And finally, focusing on the importance of the community in the achievement of malaria elimination. The CIDCA-funded project will ensure that the community where malaria most affects the people of the Gambia is engaged and active in the fight against malaria and the prevention of unnecessary morbidity and mortality. The support provided through CIDCA also helps us demonstrate our critical role in supporting the Ministry of Health and the National Malaria Control Program to achieve the ambitious malaria elimination targets that have been set by the country. Ladies and gentlemen, over the past decade, the Gambia has made considerable progress in reducing malaria morbidity, with national malaria incidence declining by 70%. However, some progress is still needed to achieve elimination. We are confident that by building on previous experience and capitalizing on its community roots and volunteer network, the Gambia Red Cross Society, as an auxiliary to the public authorities in the humanitarian field, will bring renewed energy to the fight against malaria and will reignite and accelerate progress made to date. To the volunteers and health workers on the front lines, your dedication is the backbone of this fight against malaria. To our partners, Sitka and the Gambian government, your support will help turning our ambition of malaria elimination into a reality. I want here to pay especially tribute to the embassy team that since the onset of this program has been an incredible partner. So thank you again, Mr. Ambassador, for your new team for the work on. As we launch this project today, let us reaffirm our commitment. No one should suffer or die from a preventable disease. Let us join our forces and resources with the belief that a malaria-free future is within our reach. Thank you very much for your attention.
Today, I'm honored to stand before you on my own behalf, on behalf of the Gambia Red Cross Society and our partners, participating National Society here, the Spanish Red Cross, and the International Federation of the Red Cross and Red Crescent Movement, to deliver a statement. Your Excellency, Honorable Ahmadou Samate, Minister of Health, will be representing the President of the Republic of the Gambia. Permanent Secretary, Minister of Health, Your Excellency, the Ambassador of the People's Republic of China to the Gambia, representative of the Governor of West Coast Region, and the Brikama Area Council representatives, Head of Cluster of the IFRC, Dakar Cluster, overseeing Senegal, Cape Verde, the Gambia, and Mauritania, National Assembly members here present, representatives from the UN family, WHO, directors and managers from the Ministry of Health, representatives from the Rollback Malaria Partners and all the family members of the National Malaria Control Program, the Alkali, Councilor, Imam, and elders of Brufut, Assalamu alaikum. Print and how do I call the other media houses, television and all the media houses here present. Ladies and gentlemen, see, we are bound to observe this protocol because that's what makes us who we are. Today, we are commemorating the World Malaria Day. And I'll choose to keep the remark I have presented on that part, for others have spoken on that, with your permission. But just to say that the team has been upped because the other component of this activity is a demonstration of the reinvesting and the re-energizing and all the other risks that had been put on the team to ensure that malaria and whatever it is connected with is sent out of this country. The second part, which deals with the official launching of the accelerated malaria elimination in the Gambia, which is the project of the Gambia Red Cross Society, being implemented through the International Federation of the Red Cross and the Red Crescent Societies, from both the Dakar office and the MENA office, generously supported by the China International Development Corporation through the government of the People's Republic of China. We want to thank you very much for the support. This project is intended to complement and enhance ongoing national efforts spearheaded by the Ministry of Health and its rollback malaria partners in the sheer goal of eliminating malaria throughout the Gambia. The Gambia Red Cross is getting into this partnership in fulfilling our mandate as auxiliary to the humanitarian service of the government of the Gambia. It's important that I put on note that the Gambia Red Cross Society was established by an act of parliament as a humanitarian, neutral, independent organization that will serve the Gambian people as auxiliary to the government and to provide support to the communities to alleviate human suffering wherever it may be found. This project, therefore, is expected to benefit approximately about 420,000 individuals, including 70,000 children, mainly from Upper River Region, Central River Region, and West Coast Region. We are confident that this project will bring a meaningful impact to our communities. Malaria is both preventable and curable, like everybody else have talked about now. And therefore, by working together closely with rollback malaria partners, including local communities, we will eliminate malaria and contribute to the overall health outcomes in the Gambia. This project is anchored on gender-inclusive, community-led approach and aim at fostering enhanced synergy and complementarities among all malaria stakeholders. The 2 years initiative will seek to promote, improve malaria prevention practice and timely health-seeking behavior. It will also seek to enhance the quality and accessibility of malaria case management at community level. It will help to reduce malaria transmission among children under 5 and strengthen coordination and communication among all stakeholders, both nationally and internationally. With an extensive volunteer network of over 17,000 volunteers, with our vast experience in disease control and prevention, and our recognized role as auxiliary to the government of the Gambia Red Cross Society reaffirms its commitment to supporting and accelerating malaria elimination efforts nationwide. And this project is the starting point for that. I would like to also add that this is adding up to other interventions we are doing to ensure that we alleviate human suffering, from our locally led adaptation programs to our migration support to migration and migrant returnees, to our ambulance services, one of them is standing here, to the health service program we are providing, supporting trained health personnel and providing water and sanitation in the communities, and to our continuous youth engagement programs. We are assured that when we tell you we will, we have, and therefore when we still tell you we will, we will. Let me use the opportunity by concluding by thanking the government of the Gambia under the leadership of His Excellency Adama Barrow for the support and the encouragement that they've been providing to the Gambia Red Cross Society in our auxiliary role. Please thank him for us. We also want to thank the People's Republic of China for the support and for accepting to provide this support. We also want to thank the International Federation of the Red Cross and Red Crescent Movement, Alex, and your team from both in Dakar, in Nairobi, and in Geneva. We also want to continuously thank the Ministry of Health for the continuous collaboration, being our line ministry. Let me also use the opportunity to thank the hardworking team behind us, the Secretary General, the staff, board members, and volunteers of the Gambia Red Cross Society. Thank you very much. Together, I am confident that we can achieve our shared vision of a malaria-free Gambia. Assalamu alaikum wa rahmatullah. Alkali and your team, thank you for putting up and bringing people here. Assalamu alaikum wa rahmatullah.
So, Honorable Minister of Health, Dr. Samate, Your Excellency, the Chinese Ambassador, Mr. Liu, representative of ICRC, the Permanent Secretary, and all government officials present here at the various levels, please allow me, in the interest of time, to ride on the protocol already established. Today, we join the world in commemorating World Malaria Day under the theme, Malaria Ends With Us, Reinvest, Reimagine, and Reignite. This global observance and theme offers an important moment to reflect on our progress, recognize the work ahead, and renew our collective commitment to ending one of the world's oldest and deadliest diseases. We say reinvest because it speaks to sustained funding, especially by increasing domestic funding. Reimagine speaks to greater innovation to address emerging challenges, while Reignite speaks to identifying and sustaining the roles of all stakeholders, political will, communities. I'm glad to see that we have the representative from the tourism board. I'm glad to see that the local leaders are here to just show that malaria is something that all of us will need to control, and all of us will benefit when we control that. Now, I have a written speech, but allow me to divert from my written speech so that I can speak to the community members that are here. With your permission, Honorable Minister, I'll do that. I love telling stories. In the Gambia, malaria is not an abstract threat. It is a familiar and persistent burden. From the banks of the River Gambia to the communities of Basse, Farafeni, Brikama, Janjabure, and today Brufut, the impact of malaria is felt by families every single rainy season. When the skies darken and the rain begins, so too does the silent fear of mosquito bites administered by Mrs. Anopheles, fevers, and rushed visits to health centers. Sometimes, in the middle of the night, its toll is heaviest on young children and expectant mothers and those whose health is most vulnerable.
First of all, I'd like to say that thank you for the entertainment performance. It reminds me of my childhood. 40 years ago in Chinese village, there was this kind of entertainment to educate the people. So I'm very happy to see it again. It's a good chance for me to understand the Gambians' culture and the tradition, to feel the Gambian people's joy. Yeah, thank you very much. Honorable Minister, and friends from WHO, FRC, Gambia Red Cross, friends from communities and the media circles, ladies and gentlemen, good morning. I think it's very meaningful to commemorate this special day, the World Malaria Day, with the launching ceremony of the Malaria Elimination Project. The project is accelerating malaria elimination in the Gambia, which is funded by the Chinese government through the Global Development and the South-South Cooperation Fund, and carried out by the International Federation of Red Cross and Red Crescent Society. I'm very grateful to all the parties who has already or will contribute to the implementation of this project. The Global Development Initiative, which was proposed by Chinese President Xi Jinping, aim to drive the global development towards a new stage of balanced, coordinated, inclusive development. Under the guidance of GDI, we are committed to realizing the United Nations 2030 Agenda for Sustainable Development, promoting common development among countries around the world, and to improve people's livelihood and well-being. The elimination of malaria as an important part of United Nations Sustainable Development Goals, coincide with the core value of the GDI. Today, by joining hands with the IFRC, we are changing the grand blueprint into concrete actions and helping the Gambian people to get rid of the malaria and move towards a healthy future with practical actions. Yeah. With its professional humanitarian relief capacity, extensive global network, and rich community practice experience, the IFRC provides strong technical support and mobilization capacities for this project. In 2024, the Chinese government and IFRC signed an MOU to promote cooperation on a number of projects. In the Gambia, we will work closely with IFRC, of course with the Gambian Red Cross Society, to implement this project successfully. We will reach out to the Gambian community, carry out health education, provide the necessary medical supplies and equipment, and train local medical personnel to ensure that this project can be implemented efficiently. China and Gambia are good friends and reliable partners. The cooperation between China and Gambia in the field of public health is extensive and far-reaching. As early as in 1970s, China sent 15 batches of medical teams to the Gambia, and now it is the 22nd batches of medical teams working in the Gambia. Chinese doctors have been saving lives and helping the patients all over the country, from Banjul to Falafeni to Bansong. At the same time, since 2020, the Chinese government has donated various medical materials and initiated medical projects of more than $6 million in Gambia, which has greatly improved and promoted medical and health conditions in the Gambia. We believe the world is a global village. The whole world will be better only when every nation develops well. However, some nations with the excuse of my interests first cut foreign aid projects, including malaria prevention and treatment projects, giving serious challenges to the international humanitarian courses and public health systems. Chinese government oppose this kind of actions. We will continue to help our African brothers and sisters, increase investment in Africa, and continue to build China-African communities with a shared future. That is why the Chinese government granted $1,970,000 for this project. We appreciate and support the Gambia government's effort to eliminate the malaria. Malaria is once rampant in China, with more than 22 million cases reported in early 1970s. After more than 40 years' effort, malaria is completely eliminated in China. We believe with the joint efforts between every stakeholders, the day of malaria-free will soon come to the Gambia. Thank you very much.
Thank you very much, distinguished guests. I stand here today representing the Chief Guest of Honor, His Excellency, the President of the Republic of the Gambia, Mr. Adama Barrow, and I hereby present his statement. Excellencies, Ambassador, the People's Republic of China, country representative of the World Health Organization, representative of the China International Development Agency, China Aid, head of the Dhaka Delegation, International Federation of the Red Cross and Red Crescent Societies, the President, the Gambia Red Cross Society, Secretary General of the Gambia Red Cross Society, the Governor of West Coast Region, represented here by Madam Jai, the UN representative the Ministry of Health, staff members, development partners, NGOs, civil society organizations, the Chief of Combo District, the Alcalo, and the Imam of Brufut, the ladies and gentlemen of the media, distinguished guests. I'm honored to address you today on the World Malaria Day 2025, a day of global solidarity, reflection, and renewed commitment in the fight against one of humanity's oldest and deadliest diseases. This year's theme, Malaria Ends With Us, Reinvest, Reimagine, and Reignite, calls on us to not only recommit ourselves to ending malaria, but also embrace innovative approaches and invest with renewed energy and purpose. Malaria continues to burden millions around the world, and the Gambia has made significant progress over the years, but we are not yet at the finish line. For this reason, today's events mark both a celebration of our strides and a bold leap forward in our shared journey toward a malaria-free Gambia. Today marks another important day as we launch a life-saving initiative, the Gambia Red Cross Society's project on accelerated malaria elimination in the Gambia, funded by the China International Development Agency, China Aid, of the People's Republic of China through the International Federation of Red Cross and Red Crescent Societies, and in partnership with the National Malaria Control Program, the Ministry of Health of the Gambia, the IFRC East Asia Country Cluster Delegation, other global, regional, and national malaria partners to the Gambia. Allow me to express on behalf of the government and the people of the Gambia a profound appreciation to the government of China, China Aid, and the IFRC for their generosity, solidarity, and unwavering partnership. This project is not just a malaria intervention, it is a bold demonstration of how international cooperation, local leadership, and community engagement can combine to bring about meaningful change. Together, this project will bring one, reinvest in our children's future by providing seasonal malaria chemoprevention to 70,000 children under 5 years old in Combo North. We're ensuring that the most vulnerable in our society are protected during the peak of the malaria season. To reimagine community healthcare delivery with integrated community case management interventions in the Upper River and the Central River regions, we are empowering local health workers to diagnose and treat malaria and other common childhood illnesses effectively and on time at community level. To reignite the national momentum and community engagement through robust social and behavior change communication, the project will raise awareness, tackle misconceptions, and promote early treatment-seeking behavior, proper use of bed nets, and community-led action against malaria. Distinguished guests, this project reflects the Gambia's national priorities and our commitment under the National Malaria Strategic Plan 2025. It aligns with our efforts to promote universal health coverage, strengthen community health systems, and achieve the Sustainable Development Goals, particularly Goal 3, which is good health and well-being. It is also a testament to what can be achieved when development partners, government, and civil society work together towards a common goal. Malaria Ends With Us means it ends with every community health worker trained and equipped to save lives. It ends with every parent who ensures that her child takes preventive medicines. It ends with every young person spreading awareness, every leader investing resources, and every partner standing in solidarity. This is how we reinvest in our health systems, reimagine a malaria-free generation, and reignite a national movement to end malaria once and for all. Let me conclude by saluting the Gambia Red Cross Society for its tireless commitment, professionalism, and the presence in every corner of this nation, from urban centers to the most remote villages. I want to commend the Ministry of Health team for their commitment, and our community health workers, our development partners, and all the stakeholders, such as the WHO, UNICEF, Global Fund, Catholic Relief Services, PATH International, the MRC unit, the Gambia, London School of Hygiene and Tropical Medicine, the Rotary International, working to eliminate malaria in the Gambia. To the children who will live healthier lives, the families who will sleep with peace of mind, and the future generations who will hear about malaria only in history books, this is actually for you. Together, let us rise to the call of this year's theme. Let us reinvest, reimagine, and reignite. And let us say with boldness and unity, malaria ends with us. I thank you very much for your kind attention. Thank you.
Mama ke hitele yatina ntefuta tajalia sobe mato ninte buto